So we thought we had a great day planned, but this has really gone beyond our expectations. The number of people that came today, the conversations, the feedback that I've heard from all of you, from our speakers, from the dialogue, I think we've had a great day because of the quality of our speakers, and I'll just briefly touch on some of the highlights from each of them, but also because of you, all the work that you do, coming to talk about what you do and spreading that information and good news stories with your neighbor. So we heard from Jim Easton talking about his massive improvement machine, and a lot of good information there, and I've heard lots of good feedback from the audience. But one that really resonated for me in Jim's presentation was that we have deep purpose. So our focus is people, and he said, don't let that deep purpose be driven out of you. And as the minister also indicated, he says that in our hands, the future of the most important public institution in our country. So in our hands, we have that responsibility. Then we heard from Partnerships for Health, talking about harnessing the power of the team, how they work together in different parts of the healthcare system. We heard from Dr. Sharp and Dr. Lisa talking about how the critical care units across the Southwest are working together in really a virtual ICU. And with Dr. Lisa talking about long-term vented patients, something that wasn't mentioned is that those patients actually go from the ICU to a community provider. Community provider participation house in London takes some of those clients. That's a type of transition that we're not used to hearing talking about, but it shows you how we are all interrelated in this one great big healthcare system. Mike Stubbs, our roving reporter, thanks Mike, emphasized the power of storytelling, what it means to the individuals out there in the public. And Camille, thank you for your discussions on new approaches to addressing some of those problems. New approaches that, as we talked about, are actually being adopted by other LHINs in other parts of the province. And Minister Matthews spoke passionately about the gift of the universal health care and how it's our obligation, how we hand it off to the next generation. We do have a large responsibility ensuring that we do that properly, and it's given in good hands when we do that. And finally, Stephen, thank you very much for that stimulating talk. Lots of good points there, and really discussing the value for money invested. So thank you to all our speakers. If we can give them a round of applause. Now we've reached that moment in time that you've all been waiting for. We've been teasing you since this morning about the big announcement. So if I can call on our board chair, Jeff Flo, we'd like to make a special announcement. The Southwest LHIN is very proud to announce today a new Quality Awards program at the Southwest LHIN. So this is an annual program that we're starting today, kicking off. The awards will be made at the next Quality Symposium next year. The purpose of this program is to acknowledge health service provider initiatives that demonstrate impact in driving our system towards the accomplishment of our Vision 2022 that's articulated within our blueprint. The Quality Improvement Awards of Excellence will be an annual award, as I said, and we hope that it will be a source of pride and prestige for health service providers across our LHIN. There's two categories of awards, which are in alignment with the strategic directions within our Integrated Health Service Plan. The first one is for population-based integrated health services, while the second one is for centrally coordinated resource capacity. To be eligible, the initiative must demonstrate system change and involve more than one organization, and at least one must be a LHIN-funded health service provider organization. The award will consist of a small award token for each team member, and the team name and title of the initiative will be engraved on a perpetual plaque that will be housed at the Southwest LHIN office. As I said, this award will be given at our annual Quality Symposium, and there'll be more details coming out in terms of how you apply, the nomination forms, and the timelines. So we're very pleased that we're announcing this Quality Award today. So in closing, I'd like to thank the Planning Committee. An event like this does not go off without a great deal of hard work by a number of hardworking people. We have had a planning committee that not only consisted of LHIN staff, but also of providers from our health service providers. Sue McCutcheon, and it's hard to see people with the lights, from Brave Bruce Health Services, Gord Malak from the Southwest CCAC, and Lana Dunlop from the Southwest CCAC. We also had Dr. Stuart Harris and Dr. Michael Sharp helping us with the CME credits, which were discussed at the start of the presentation as well. And And my sincere thank you to all building staff that have been involved in putting this quality symposium together today. That includes Kelly Gillis, Julie White, Christina Jansen, Matthew Clark, Veronica McLean, and Rita Cassiano, and together with a number of other LHIN staff that are here today helping out putting this event on. Your efforts are certainly appreciated. And I'd be negligent not to offer my thanks to all the staff that are back at the ranch, actually doing the work that we do day in and day out. As all of you, this is a day away to actually expand your professional development, learn about new and innovative ideas that you can take back to your own organizations, but the work continues. And we've had a number of staff still back at our office fulfilling those obligations and responsibilities. So with that, I will end today the way we began. I really want to sincerely express my appreciation for the great work that you undertake day in, day out on behalf of the patients, clients, and the residents you serve. We all have an extremely important job to do, and I hope that this session will help you deliver on it going forward in the future. Saying that, we now have our governance session starting in about a half hour. So for those people that are staying for the governance session, if you can make your way into the next room, which is behind the wall at the back of the room.
Good luck with that.
You can start your dinner. And again, thanks very much for coming today.